I'm going to be discussing the aspects of management of patients with early stage breast cancer in the advanced setting. And this is an area that has evolved a lot in the last few years. The most important thing about treating patients with metastatic hormone receptor-positive breast cancer is at the time of initial diagnosis, it's important to confirm the histology. Number one, you want to make sure that the patient truly does have a breast cancer metastasis, depending on where the most easiest lesion is to biopsy, whether it's in the lung, the liver, sometimes in the bone. But also importantly to check the receptors, estrogen, progesterone, and HER2 receptors, since that can sometimes change from what the primary tumor was. And of course, in the case of patients who are presenting with metastatic breast cancer, it also serves as a confirmatory diagnosis. Now, over the last several decades, the pendulum has shifted to treating patients with metastatic breast cancer according to receptor subtype. And for patients with hormone receptor positive and HER2 negative breast cancers, the general paradigm for treatment is to use endocrine therapy first. It used to be, even as recently as a decade ago, that chemotherapy was the first treatment that patients would get. But we now know that if we start with endocrine therapy, for most cases, the patients will actually have a better quality of life. And even though randomized studies have been few and far between, the ones that have been done suggest that survival is the same. And some series actually show that survival is better.